A reanalysis of MRI data that were assembled during one of the pivotal trials with Aubagio, with teriflunomide, and which used a well-established method that has also been used in other trials with other compounds, and compared the development of brain volume over a period of 2 years, so the double-blind controlled phase of this study. The idea was that there was some kind of discrepancy. On one side, with this agent, we had a statistically robust effect on disability progression over time. On the other side, the MRI data regarding inflammatory markers were also quite positive, but the data with a different method of analysis on development of brain volume were not really conclusive. There was an effect on gray but not on white matter, so that was disputed, and therefore we decided to perform a reanalysis, a fully blinded reanalysis at our center in Basel, the Medical Image Analysis Center that has also done this similar analysis in other contexts, in other trials, and to use a well-accepted method of SIENA, called SIENA. The findings were that teriflunomide in the approved dosage did have an effect on brain volume change. That means that brain volume change was reduced by approximately 30% during this trial, a difference that was already statistically significant after 1 year and was then confirmed after 2 years. The immediate practical consequence is not there, but there is increasing evidence that this makes a difference over the long term, and that measures of brain volume change are correlated with clinical outcomes, both traditional clinical outcomes like the EDSS, but also outcomes that are related to cognition, to quality of life, and so on. The SIENA method is a method that was derived several years ago, which after registration of images, that means you get the images on different time points and bring them into a certain network of a referral network and and then can calculate differences in the volume in different parts of the brain and derive percentage change. So it's not an one-shot method, but is a method that has been used to compare one scan with another scan. Well, I think it's reassuring that with this objective method we see also a difference on something that indicates damage, more permanent and more permanent tissue damage. Well, I think it's an optimistic view of the future of MS treatments, that we have several different options, and we are learning how to best use them in the best interest of our patient. And I think this is an important message to know about for all doctors who may encounter or may see patients with MS. It will be interesting to see if there are differences in different groups, and of course how this relates with longer-term outcomes, and also to improve the method. One of the endeavors that has been followed or is being followed by different groups is how to bring this into something that really can be used in individual patients, because what we see now is differences across groups, but the individual variability precludes, in most cases, the use of this method for individual patients. And getting enough normative data that allow to standardize the methods of MRI imaging and then assessment would help to use it also for a more individualized approach to treatment.